The heart monitor flatlined precisely at 3 o'clock in the morning, casting a steady, cold hum across the intensive care unit. Safir Ahmed, a wealthy textile tycoon from Faisalabad, was dead. Dr. Zain Malik, the most revered cardiothoracic surgeon in Karachi, stared at his own hands in absolute disbelief. The bypass surgery had been flawless. There were no lacerations, no internal hemorrhaging, and absolutely no postoperative anomalies. Yet, the patient had expired. Within minutes, the hospital security staff locked down the wing, but every digital sensor, every nurse on duty, and every closed-circuit television feed confirmed a chilling reality. No one had entered the room. The patient had apparently died of natural heart failure, yet something felt deeply sinister. Investigator Tariq Lodhi arrived at the elite private hospital in Clifton as dawn broke over the Arabian Sea. The atmosphere inside the grand glass building was heavy with panic. Lodhi carefully examined the sterile room. The saline drips were untouched, the surgical incisions were clean, and the medical logs were meticulously detailed. A senior nurse, her hands shaking as she held her cotton dupatta, swore that she had monitored the machinery every 15 minutes. Nothing had fluctuated. The initial toxicology report returned completely clean. There were no foreign substances in the blood. Yet, Lodhi noticed a peculiar detail on the corpse. A microscopic puncture wound, surrounded by a faint, blue discoloration, marked the webbing between the victim's toes. Safir Ahmed was not merely a wealthy businessman, he was a man with powerful enemies across the province of Sindh. His massive textile empire had recently outbid a fierce corporate rival for a lucrative government export contract. Dr. Zain Malik had been his personal physician and close friend for over 2 decades. The surgeon had a reputation for flawless precision, having performed thousands of successful operations on the Pakistani elite. As Lodhi began interviewing the hospital staff, he learned that Safir had insisted on this specific private wing, paying millions to ensure absolute privacy and security. The investigation revealed that Safir had received a threatening letter at his Lahore residence just 1 week prior to his admission. The police raid on Safir Ahmed's corporate headquarters yielded several encrypted files. Lodhi discovered that the tycoon was preparing to expose a massive money laundering syndicate operating through legitimate medical charities. Strangely, one of the primary beneficiaries of these charities was the very hospital where Safir died. Dr. Malik grew increasingly defensive during his second interrogation. The surgeon insisted that his only focus was saving lives. Meanwhile, forensics experts struggled to identify the cause of the blue mark on the victim's foot. The mystery deepened when the night shift security guard abruptly resigned and disappeared from Karachi, leaving his rented apartment in Lyari completely abandoned. Lodhi tracked the missing security guard to a small village near Hyderabad. The terrified man confessed that he had been paid a massive sum to loop the CCTV footage for exactly 7 minutes on the night of the murder. However, the guard swore on the Holy Quran that he never saw anyone enter the corridor during those 7 minutes. He had watched the hallway with his own eyes. The plot twisted violently when a second toxicology screen was ordered, utilizing specialized equipment from Islamabad. The results were shocking. Safir Ahmed had been injected with a highly volatile, untraceable synthetic potassium compound that mimics a natural cardiac arrest and dissolves completely within 2 hours. The focus shifted entirely back to the surgical team. Lodhi realized that the killer did not need to infiltrate the secure room after the surgery. The lethal dose had to have been administered during the operation itself. Dr. Malik was immediately arrested at his residence in Defense Phase 6. The police discovered a hidden compartment in the surgeon's leather medical briefcase containing empty glass vials with foreign labels. The media erupted with sensational headlines across Pakistan. A brilliant savior of lives was now branded a cold-blooded assassin. Dr. Malik sat in the dark interrogation room, weeping silently, refusing to speak a single word to the detectives. The ultimate revelation emerged not from the hospital logs, but from a forgotten medical registry in Punjab. The real Dr. Zain Malik had actually died in a tragic car accident in the United Kingdom 5 years ago. The man practicing surgery in Karachi was his estranged identical twin brother, Asif Malik, a failed medical student who had assumed his brother's elite identity to escape massive gambling debts in London. The money laundering syndicate had discovered Asif's true identity and blackmailed him into executing Safir Ahmed. The injection between the toes was performed on the operating table, timed precisely to stop the tycoon's heart hours later in the locked ICU. The shocking exposure of the imposter surgeon sent tremors through the entire Pakistani healthcare system. Asif Malik was convicted of first-degree murder and identity theft, receiving a sentence of life imprisonment at the Central Jail, Karachi. The powerful corporate figures who orchestrated the blackmail fled the country, leaving behind a ruined medical empire. The elite hospital wing remains permanently closed, a dark reminder of the night a phantom doctor committed the perfect crime. True justice was served, but thousands of former patients are left wondering who actually held the scalpel during their darkest hours.